And Wisconsin is approaching 4,000 deaths from COVID-19. Staff at Mayo Clinic Health System's COVID unit say demand for their help is only growing.
News 8 Now's Jordan Fremstad takes us inside one of those units where people are fighting to stay alive.
It's hard to put things into perspective when all you see are numbers.
Yep.
Allow Mayo Clinic Health System nurse Katie Hansen to explain.
You're spread really thin.
On a floor where she volunteered to spend her work days.
It's stressful here. It's hard.
Cases are rising as this surgical floor is now a COVID-19 wing.
We currently have 2 COVID unit floors here.
Okay.
This is where Rushford's Cindy Bovey has been for a while.
November. Yep.
Her family is not allowed to visit.
So I think they're going to be very sick of running my phone back to the charger because that's my only communication.
Nurses and doctors have to cut their visits short too for safety.
Or you go in, you do your job, and you come back out. So it's hard dealing with that.
Because they have families too.
I have a baby at home, so that's challenging for those who are supporting me in my home life as well.
It's the toughest pill to swallow because for many patients, their final days are spent here.
We deal with people that die and their family are not able to be here with them, so staff are that family.
People like Dr. Melissa Myers end up delivering more of this kind of news.
Whether or not they're going to survive this, and having maybe one of those conversations a day is something that's part of our daily work.
There are patients like Cindy who get better.
I'm feeling 100% to what it was when I came in here, yes.
But still not the same as they were before.
They're not walking out of here, they're rolling out of here.
Nonetheless, these caregivers help ensure families have their loved one around Christmas morning.
And I just wish that I could do more to help them.
If there was any way possible to give them super bonuses, I'd probably be #1 on the list.
This is Jordan Fremstad.
Keep your neighbor in mind.
News 8 Now.
Wear your mask.
Crosse.
And Cindy, the patient you heard from, says people who have underlying health conditions need to be especially careful. She has diabetes, a condition that puts people at higher risk of the virus.